Assalamu alaikum doctors. In this video I am discussing communications. It's a recall, very common exam, non-accidental injury, and the task come like that. Male is 10 months, came to the emergency room with common cold. During examination you notice that he is smelly with the dirty clothes and he is full of bruises in his back and around his mouth. Talk to mother about need of admissions. I'm giving some tips before starting. In this communication, your voice tone must be firm when you talk about need of admissions. You will say that we need to admit him to exclude NAI frankly. This is the only scenario you are allowed to ask the mother from where he got these bruises. Try not to reach to police or court in conversation. If NAI positive, life-threatening, not allowed to mother to stay with the child. If NAI positive, not life-threatening, allowed to stay with her child. So remember on life-threatening, mother will, accordingly mother will be stay with the child. So how can we do that? As usual, IRCAP. Hello, Mrs. Salma. I am Dr. Emma, one of doctors here. I guess you are Alice's mommy, is not it? Yes, doctor. So thank you so much for giving me some of your time. I hope your trip to hospital is good. Yes, it was good. Ma'am, I am here to talk with you about Ali. Do you like anyone to be here or shall we start? No, doctor, we can start. So do you have any idea about Ali's conditions? Yes, he is having flu. Actually, yes, he is having flu and for that we will give him a treatment, but during examining him we notice that he is having bruises all over his body, especially on back and around his mouth. Do you know from where he got these bruises? Yes, he is very naughty. I can understand that he can be very naughty and bruises easily, but we just need to keep him in the hospital to make sure that he is safe. Why, doctor? Because we wanna what are the cause of these bruises? So what are the causes? There are some medical cause of bruises, like it may be vitamin K deficiency, maybe bleeding problem, or in some cases he may have cancer. We need to exclude all these causes by doing some test, imaging of his head and imaging of his body. So first we tell that what are the disease we think. OMG, yes, you can this all test and I will come back tomorrow to know the result. I would like to thank you for your consent to take this test, but actually we have to keep him in the hospitals. Why, doctor? I do not understand. All of these tests came back normal. If came back normal, so maybe someone threatening his safety. What are you saying? I am bruising my child? No, ma'am, I did not say that. Just I said we want to keep him safe. He is safe with me at home. Do the test and I will take him home. I will not admit him. May I know why? Because, doctor, I have another kid at home. I cannot live alone by himself. I can understand how do you feel. We can arrange with the social service to send someone to stay with the other kid at home. I do not want to leave my child with stranger. If you want, we can arrange with the social service to stay with your child here and you can take care your child at home. No one will call social service. I will take away my child. Oh, I'm really sorry to tell you that we are forced by the law to keep Ali here in the hospital. Why, doctor? We just want to make sure that he is safe. You will take him away from me. You are his mom and you are more than welcome to stay with him here in the hospital, but we cannot discharge him. What do you mean by, doctor? I'll get a court order. I understand your feelings, but till you get the court order, he will be here with us to make sure he is safe. So if it is NAI education task with the medical student, contact the consultant on call responsible for child protections. Coagulation profile, calcium profile, some test we will do. Less than 1 we do the CT scan of brain, and less than 2 years skeletal survey and repeat after 10 days, and we make sure that other siblings are safe at home. So educational task will first tell the definitions, like someone threatened his life, unusual injury. Then of course we will take the proof when they come and we call the on-call consultant and we do some tests like bleeding profile, coagulation profile and the skeletal survey, calcium profile. Less than 1 year CT brain will do, less than 2 years skeletal survey, which is again repeated after 10 days, and we make sure that other siblings are safe at home. Thank you.